everyone. Thank you for taking time out of your day to be here. I am Walla. I'm the founder and CEO of Auggie. And what we do really well at Auggie is bring parents together into our community. And by doing that, we meet a ton of awesome experts. That's how Dr. Sara and I got connected. If you've ever wondered what's actually going on down there with your pelvic floor during pregnancy or maybe after, I'm almost 8 months pregnant, so I'm definitely wondering that. Um, if you've experienced anything from leaking to discomfort to just not feeling like yourself, I actually was like, am I having contractions last night? Which we can talk about, Dr. Sara. Um, Dr. Sara is widely known online as the Vagina Whisperer. She's a nationally recognized pelvic floor physical therapist and educator who has dedicated her career to helping parents understand, care for, and advocate for their bodies, which we all need. So we will get into the conversation in 1 minute. Just a small piece of housekeeping. This conversation is being recorded, and we want it to be interactive. So feel free to write into the Q&A, and I will do my best to get Dr. Sara to answer your questions. So Dr.
Yes,
Sara, you kind of gave your background, but maybe just start quickly again because more people are joining, and then we'll get into the.
yes. So I am a board certified pelvic floor physical therapist. I have been a pelvic floor PT for over 18 years. I'm also a mom of two, so I experience firsthand the changes that our bodies and our pelvic floors go through during pregnancy and postpartum, and then trying to navigate and juggle mom life and working life and caring for our bodies. I do have an exciting announcement that I do have a book coming out next week that I want to share with y'all. It's
Yes.
called Floored, and it's a woman's guide for pelvic floor health for every age and stage. And there's an entire section on pregnancy and postpartum, and even how to prepare for childbirth, whether you're having a cesarean birth or vaginal birth. I really feel like it's the missing piece in childbirth prep because we get so much education on caring for the baby that we don't get a ton of info on how to care for mom. So it's a guide I wish I had when I was expecting and recovering. And I'm in New Orleans and I see patients 1 day a week. I have an online platform called the V Hive, which has online workouts for your pelvic floor and core for every stage of life. And I, as Lily mentioned, just really vocal about, I think, the need for more pelvic health education for women, for moms in particular, because I feel like we are often left behind, in so many ways. But I think in a very physical sense, our bodies go through a huge transformation, and we're just not given the guidance and tools on how to recover and how to care for ourselves. So I'm your pelvic floor PT in your pocket today. So please ask your questions. Nothing is TMI. I'm happy to answer them anonymously. You can put in the chat just to send it directly to the host. But I really want to be a resource for y'all during this journey.
Awesome. So let's start with the basics because I don't even know if I know the answer to this. What exactly is the pelvic floor and why does she matter?
I love that you called her a she. The pelvic floor is a basket of muscles that sits at the bottom of your bony pelvis. So we
Okay.
can all envision those pelvic bones that we
Yeah.
see on skeleton jammies that our little kids have or skeleton models. And at the very bottom, there's an opening, but in our bodies, that opening is actually covered by a floor of muscles called your pelvic floor. And that floor supports your uterus, which is supporting a growing baby, and your bladder, which holds urine, and your rectum, which holds poop. And then it also has three openings for urine to exit, for the anal opening for bowel movements, and then the vaginal opening for vaginal birth, vaginal intercourse, and menstruation. And so, particularly for pregnancy, we get those text messages that are like, your baby's the size of an avocado, then it's the size of a papaya, then it's the size of a watermelon. Well, if you imagine a hammock holding a avocado, it's not going to change that much. But if you imagine it holding a watermelon by week 40,
A
then
coconut.
a coconut. If you imagine it holding kind of a larger, like a pumpkin or a watermelon, when baby's full term, that hammock is going to sink lower. It's going to get stretched out. It's not going to be able to support you or your organs as well. And that's what leads to leakage and hip pain and prolapse and, decreased sexual sensation. And so pregnancy itself changes your pelvic floor, regardless of whether you have a C-section or vaginal birth. So that's a great time to really start being proactive about pelvic floor exercises.
I love that visual of the hammock because, yeah, when you say it like that, it does make sense. Regardless of a vaginal birth or a C-section, your pelvic floor is bearing this weight. And I feel like
Correct.
a common misconception that I heard even from the OB, actually, I'm not delivering with the same OB partly for this reason. When I was expecting my first, was that because I had a C-section, I didn't need pelvic floor therapy.
Completely incorrect. And if anything, C-section moms need pelvic floor therapy because we don't just treat the pelvic floor. We look at your abdominal wall. We work on the scar tissue of your C-section, which can get stuck and lead to that cesarean shelf. And C-section scar restriction can actually lead to painful sex, painful periods, constipation, incomplete bladder emptying. So if anything, C-section moms like absolutely need therapy because they've gone through major abdominal surgery in addition to the pelvic floor changes of pregnancy. And it's unfortunate because I think our OBs just haven't been trained on
Yeah,
pelvic floor. And it's like they're so busy and they're just kind of like, we don't know what that is. And like, you'll be fine. But again, I
and
mean, you would think that
suffer.
medicine would have progressed over 20 years if we know that there's a therapy to help women function better and feel better and have babies more comfortably and have less pain. Like, why aren't we utilizing it as the standard of care?
That is wild to me. So when it comes to common issues, because you hear a lot about leaks, you hear a lot about pain, what are the most common pelvic floor concerns? And I guess how can you tell the difference between what's, I hate to use this word, but like normal and then like what needs attention?
So, everything that I talk about is not normal. And there's
Okay.
just different ranges of variance of how severe it gets. So, urinary leakage is hands down the most common symptom I think pregnant and postpartum moms experience. And this is leaks with a cough, a sneeze, a jump on the trampoline, running, exercise. No amount of leakage is normal. It's really information from your body that your pelvic floor muscles can't hold in the contents of your bladder when there's pressure from above. And that doesn't get better. It gets worse with every pregnancy, and then it gets worse with aging and physical activity and weight gain. So, like, the trajectory is not a positive one. So, you really want to get on top of it. Research is very clear that if you actually address leakage during pregnancy, you're less likely to have it postpartum. But if you also address leakage within the first year after giving birth, you're less likely to have it long term. Now, you can come to therapy at any time. It's never too late, but it's always the sooner the better. Don't feel like, let me just give it time and hope it gets better. The second thing is painful sex. So we often think of like the vagina gets looser or weaker after giving birth, but over 80% of moms experience a perineal tear with a vaginal birth, and that scar tissue can get tight and restricted. You also have vaginal dryness from lactation or breastfeeding that can cause discomfort. And then C-section restriction can also cause painful, like tight tissues in the vagina. So all of those things lead to also painful sex, which again, very treatable. And then other kind of symptoms are like pelvic organ prolapse, hemorrhoids, and constipation, even abdominal separation, diastasis recti is actually related to your pelvic floor and core. So that's another really common thing that we treat a lot. But even things like back pain and hip pain, pubic symphysis pain, sacroiliac joint pain, just these things that we always think like, oh, I had a baby, like, you know, but it doesn't mean it's normal. It's common, but it's not normal and definitely needs attention.
Yeah, it's almost a little sad because you hear, or like when I'm chatting with my mom friends, like, oh, I just peed a little, or like I can't run, but it's like that's not normal. Um,
I
and then
know.
hearing from you, so leaking or pain, none of it's normal. And
None of it's normal. And, I think that it's common again, but I think that if we really had a healthcare system that prioritized prevention and early rehab, then a lot of these symptoms would get better sooner. It's not to say they're not going to happen.
Yeah.
Like, of course, your body's changing and transforming, your ligaments are looser, your muscles are stretching. But I think that we can't ascribe women to say, like, this is your destiny because you had a baby. I just don't feel like the physical sacrifice we have to make should be accepted. I mean, because there's help, like, it's very treatable.
100%. And I was the first one in my friend group to have a baby. So when I went to the OB and she said that to me, I trusted her as the expert in my life. And that's unfortunate. And I think, to your point, very common, and many people don't even know what pelvic floor therapy is or that it exists. And I think because of that, then you find out about it and it's like, wait, am I getting fingered or is it awkward? So can you talk through like what a typical section session looks like and how, yeah, I guess the follow-up question would be how do people know when they need to see a specialist? But it's pain and leaking, and both things are not normal.
Right. And I think the great thing about our healthcare system, if anything positive has come over the past 5 years, is that we have a lot of options for medical care now. You
Yeah.
can do in-person sessions, you can do telehealth sessions, you
Your
can do
workouts.
online workouts. You have my book, which is available. So not everybody's ready to take the leap
Yes.
into like, let me go to in-person therapy, or is one even in your area? So I think let me first start with how to find someone because
Right.
it's not, you don't always have one kind of right next door. So there are pelvic floor therapists. They can be physical therapists or occupational therapists all over the United States. Every major city has them. I would first ask your OB because some of them may have a referral. And if they tell you that you don't need it, then I would keep searching. There's no negative side effects to pelvic floor therapy. I would ask your mom friends. I think word of mouth and referral is the best bet. So, like in a mom chat room or, um, your play group or whatever the case may be. I would even just do a Google search, like pelvic floor therapist near me, and they'll pop up. And then there are some online directories. One's called pelvicrehab.com. Another's called the Academy of Pelvic Health, and you can search via zip code. The second thing is when you go see a therapist, it's one-on-one. It's not like you're in this big gym with like multiple patients around you. It's one-on-one in a treatment room. The therapist will ask you a lot of questions. So you'll sit down and chat first, and they'll say, "Oh, tell me about your pregnancy," but they'll also probably ask you about pooping and sex and previous, childbirth, menstruation. They want to get a whole picture of your pelvic floor health.
And
And then
does it feel like you're at the OB? Like, are you in a room with a medical table?
well, they have like a bed that you can lie on, but it's like a medical bed, but it's much more cozy. I mean, there's no stirrups. If it's in a hospital, it's going to feel more clinical, but we have a clinic that like it feels almost like a spa. It's like we use real sheets and we've got curtains and white walls and just cozy chairs. And so it really depends on the clinic. But you sit and chat, and then the exam, they'll do some external stuff by looking at your low back, your pelvis, your abdominal wall, and then they'll do an internal assessment if you consent. So there's always consent. So an internal assessment means you undress from the waist down, you have a sheet that's kind of lying over your tummy on your pelvis, and then they look externally at the vulva, look for tissue changes, anything kind of unusual. And then they'll ask you to contract like you're doing a Kegel and then relax and then push and bear down like you're giving birth or having a bowel movement. And that just shows us how your pelvic floor muscles are moving. And then they'll do an intravaginal exam where they put on a lubricant on a gloved finger and then they'll insert it into the vaginal opening. And that's how you assess the pelvic floor muscles. And they'll do the same thing, contract, relax, push, and they'll press on the muscles on the side to see if there's tension in them. And then some people do have a rectal exam if they have any rectal issues or it's a male body or they don't want a vaginal exam. And then that's it. And then we kind of take the information we found from your body and your muscles to say, is this tension? Is this weakness? Is this incoordination? And then we give you exercises and stretches and lifestyle modifications at home to work on.
So
So
tension versus weakness. What was the third thing that you said?
in coordination.
And are there different exercises for all?
Totally.
Right.
And I think it's a great point, Lily, because often when we think of pelvic floor therapy, it's like Kegels, Kegels, Kegels. But Kegels strengthen your pelvic floor. And a lot of women need relaxation of their pelvic floor. Just like you get knots in your shoulder and they get headaches, it's like, and you need to rub that knot out. It's the same thing in these pelvic floor muscles. We need to release the tension before we strengthen. So you could be walking around doing Kegels, Kegels, Kegels for tailbone pain or painful sex or even bladder leakage, and it's the wrong thing and it's making your problem worse.
And I've seen in the community something that's come up, and I'm curious your thoughts on it. Somebody described it almost as like a weighted tampon that you wear. So you insert it, and then I don't know if that's the proper term, but you have to keep it up so that your pelvic floor is working. But it seems like that only potentially, and I want to hear your thoughts, could be good for maybe one of the pelvic floor issues, not necessarily to treat all of them.
Right. And it's so what is called is biofeedback. And that's like it looks like a tampon and it's got like a core to it. There's also home pelvic floor trainers that are similar to this. And when you squeeze around it, it shows you on a little screen or on your phone how well you're squeezing, how long you're holding it, and how well you're relaxing. So you can use it for strengthening or weakness. I'm sorry, strengthening or relaxation, but depending on what issue you have, you kind of need to know what you're looking for. But not every therapist does that. We do have it in our office, but to be honest, I don't use it a ton.
Yeah.
It's a great thing to kind of get someone to connect to their pelvic floor, but eventually, I want you doing these exercises for strengthening, like in your workouts, in your day, picking up your kids, lifting weights at the gym, like learning how, before you cough or sneeze. I want you to functionally use the muscles and not just squeeze with a weighted tampon inside.
That makes complete sense. And if you don't have a therapist in your neighborhood or you want to just opt in to see someone virtually, what does a virtual session look like? And do you think they potentially take longer to see results, or can you have the same outcome?
I think it's interesting. There's no replacement for in-person care, but the fact of the matter is that it's difficult to access sometimes. There's not enough pelvic floor therapists in the United States. You have to leave work, you have to have, pay insurance or self-pay, you have to have childcare, you may have to travel and drive. So it's almost like going to a gym to see a personal trainer versus doing a home workout. Like they can be both beneficial, but it just
Can't
depends on what's
compare.
convenient for you or if there's a long wait list. Now, virtual care is actually a lot of education, but we even do stuff like we'll look at someone's diastasis, we'll look at their posture, we can actually see their home environment, which is kind of nice and be like, okay, like practice this or like get out of bed this way, or what workout equipment do you have at home that we can kind of train you on? So there's pros and cons to it. It's just also really convenient. Like you can pop on a session at 7:30 at night. Like we have an online therapist for the Vagina Whisperer, and she does like Friday afternoon sessions. She does lunchtime sessions. So you don't even have to leave your house. And there's research to show that 1 hour of pelvic floor education can help someone improve their symptoms because we don't get this education. Like we don't even know if we're peeing right or working out right or pooping wrong or, things like that. So there's definitely a benefit to it. It's just not the same.
One of the, I would say, most surprising thing about my personal labor experience was I pushed for 4 hours and I ended up in a C-section. And I never felt like I was properly taught leading up to birth how to push.
Right. Right. You're right. You weren't.
So if anybody is expecting on this call, what would be the number one tip that you give for learning to push? Is it, I mean, maybe you can show us on this call and that's enough, or maybe it's book a virtual session strictly to ask about
Yeah.
that.
So, a couple things.
Oh, and someone wrote in that they got a doula and hope she teaches me how to. So I actually also want to hear your opinion on a doula in birth and if they can be helpful when
Yeah,
people.
I'm a huge fan of doulas. Like, and I'm a data nerd. So I'm going to go to the research and be like, what's the benefit to having a doula? And it's very clear that you have, you know, you're more likely to have a vaginal birth. You are less likely to have, discomfort, tearing. You're less likely to have longer pushing stage labors. So I, to me, when I read that, I was like, I want a doula. Like, what's the negative side effect for me? And so I opted for that. I think the biggest thing if you are wanting, if you desire a vaginal birth, is you do have to prepare and you have to kind of understand what the role your pelvic floor muscles play. So you have your uterus and then your cervix, obviously, and your vaginal canal is just kind of a pathway to the uterus, right? And the cervix. So when you are dilating, we talk about cervical dilation, how it's when your cervix is opening up, the opening to the uterus is opening and then thinning. That's a
And
facing,
what's full dilation look like?
10 centimeters.
10 centimeters.
So that's like the size of a large donut or a bagel.
Mhm.
And but the dilation is unrelated to your pelvic floor muscles, really. What is important for dilation is movement. And so because we need the pressure of the baby's head to be on the cervix. So when we're lying in bed in a hospital because we had to be induced or we opted to get induced, like we just don't have gravity working in our favor. So I'm a big fan, even if you are induced, to like use peanut balls, which they have in the hospital, change positions every 30 minutes. So you're trying to mobilize the pelvis and use it to your advantage to get dilation to progress.
Okay.
And
And can
then,
you do that with an epidural too?
totally,
Great.
100%. The majority of women have an epidural.
Great.
If you don't have an epidural, you can get up and move around like no problem. Now, once you are dilated, something called laboring down can happen where you just like sit and chill for 30 minutes. But the research is very mixed on whether that's helpful. I usually tell moms, like, if you feel like you want a break, ask for a break for 20 to 30 minutes. If you feel fine and you're ready to start pushing at 10 centimeters, then start pushing. And I think a couple things to tell people, and I go over this in the book because it's really important that we know that we have options. Like we're really told in the hospital, like this is the way to do it. But if it's not working for you, you can be like, can I try something different? Like
Yeah.
to push for 4 hours lying on your back in one position and not, it's like, okay, if that's not working, like let's try something else. So I would have been like, let's roll on your side, Lily. Let's try holding your breath if you've been breathing out. Let's try breathing out instead of holding your breath. Like let's do something different because you're exhausted. And so when you start pushing, you can lie on your back with your legs up. You can lie on your side with one leg up, even with an epidural. And even with an epidural, you can get into hands and knees. And I tell people to kind of get into hands and knees position. You might have to have people support you, but you put your knees in and your feet out. So, because that opens the bottom of the pelvis. So, like using your limbs to like help you open the pelvis. And then you should push with your contractions. So if you don't feel your contractions because your epidural is high, I would try to keep your epidural on the lower side so you can feel your contractions and it'll feel like pressure in your butt. Like when I was pushing, my baby was kind of like crowning, I was like, I'm either about to have this baby or I feel like I'm about to take the biggest shit of my life. Like,
Yeah, like my butt's about to explode.
and you're like, okay, we're right there, right?
Yep. Right. So that's the feeling that you're looking for, everybody.
And then when you feel that pressure or you see on the monitor that you're having a contraction, that's when you push. And to push, you can hold your breath or you can breathe out and you're pushing. Your pelvic floor is not pushing. Your uterus
Someone
is
just
pushing.
wrote in Ring of Fire.
Ring of fire is like when that baby's head is at the vaginal opening. So you're going to push with every contraction. You're going to, push for 5, 10 seconds. And then you're just going to relax. And then you push with the next contraction. And when baby's head is like right at the opening, you almost want to hold it. You're like, okay, hold it, hold it, hold it to stretch the vaginal opening. And then you push again. What's really important is that um, your pelvic floor muscles do not push your baby out. They need to get out of the way. Your uterus pushes your baby out. So during pregnancy, strengthen your pelvic floor to give you support. But in that last third trimester, you need to work on relaxation of the pelvic floor muscles, massage, hip openers. The way that you poop on the toilet is the way that you push during vaginal birth. So practice every time to practice that bearing down and opening up and figure out like, do I do it better in sitting? Do I do it better in squatting? Like practice these things in advance. Use a mirror. Like in our clinic, we use a mirror so you can see what your body's doing.
Brilliant. Yes, I love that. Someone just wrote, I have nightmares about hearing bear down my last delivery and then tearing. I also got a doula this time around.
Yeah.
That's great.
So, and tearing is common.
Yes.
I recommend doing perineal massage during, and I have a whole demo on this in Floor too, because I think a lot of people don't really understand like the perineum's like between the vagina and the anus. and they just like rub it like this. And I'm like, no, it's not like this. You need to go in the vagina and like pull down the vaginal opening to stretch and soften. And you don't need to do that during delivery, but do it in advance starting
Yeah.
around 34 weeks. So that's one thing is that it's if you haven't done it before, during delivery is almost like I would just be like hands off.
Yeah.
But during it in advance can soften those tissues so that when you push and bear down, everything's like soft and relaxed.
And what about, I saw on Instagram, so I definitely want to fact check this with you, like a warm compress down
Love
there.
it.
Great.
During birth and when you're pushing, a warm compress, breathing during birth, pushing during contractions.
Zoom
Uh,
likes these. You're getting
I
it.
know. And those things are all beneficial. And birthing on your side, birthing on your side is actually the position that has the least likelihood of severe tearing. So again, options. But when I see people in therapy, we practice all of these, and I'll have a mom who's like, "Nope, lying on my back, holding my breath, best, most effective pushing." I'm like, "Then that's what we're gonna do," you know?
Someone just said they have a friend who laughed their baby out.
Oh, that's a dream.
Love that. That sounds like a party. Um, Selfish ask, I'm in Brooklyn and I need a doula. So if anyone has a recommendation, or Dr. Sarah, if you do, we can talk offline.
There's have you connected with Latham at Latham Thomas? She has a place called the Soul Space, but she's actually a doula and she has an incredible community out there of doulas too.
Amazing. I'll be able to check her out right after this. Okay. I don't want to assume everyone is expecting on this call. So, how should pelvic floor care differ across different life stages? Like, and you hear sometimes with older women, like, oh, I peed a little or I don't have bladder control. Is that because they didn't preventatively do this work when they were our age?
So
Um,
it's a
the exercise changes based off of age.
Yeah. I think one of the biggest misconceptions is that only pregnant and postpartum and aging women have pelvic floor problems, which
Yeah.
is not the case. Your pelvic floor really requires something different at every stage of life. So, from even when you start menstruating, so if you have young daughters, this is the kind of information you want to know so you can kind of educate and coach them to when you become sexually active, obviously, pregnancy and birth and postpartum, but then even into perimenopause and menopause. The reason this is more common with aging women is one, you have likely given birth a couple times. The majority of women do, and that plays a role. Second is that when you age and you get closer to perimenopause and menopause, is you have less estrogen in your body. And estrogen like plumps up the vagina and the pelvic floor muscles, helps provide lubrication. So when you don't have that estrogen in the vagina, your muscles get weak and thin and you don't have as much collagen production, which we think about for our face, but it's the same thing for our vagina. And so your muscles down there just get weaker and thinner, and that can lead to more bladder problems and leakage and prolapse. So you also have less testosterone, which builds muscle. So you have to kind of proactively strengthen, like you're more susceptible if you do nothing. And I'm 42, so I'm in perimenopause, and I'm like, strength training, like I started playing tennis at 40. I decided to like take up a new sport. And I remember I was on a tennis court and I like moved quick and I was like, "Oh my God, I think I just leaked." And I'm like, "I'm the vagina whisperer. Like I can't pee my pants." It's like this is off brand for me. And it was a signal like one, I'm doing a you know, new fitness routine, but two, like I'm getting older and my pelvic floor is just getting weaker with aging and perimenopause. So you really have to be proactive during perimenopause to strengthen proactively your muscles down there. And then once you learn how to do that, you build it into your fitness routines. But we're having babies older, and going from pregnancy to postpartum to perimenopause is one blurry season. And then before we know it, we're like, wait, what is going on with my body? So I really encourage folks to be proactive about it and kind of look out for those warning signals during perimenopause and menopause of like, oh, I need to get on top of this.
So Rebecca just wrote in, Rebecca, let us know if there's a specific question you want us to answer here. But she says, I'm almost 2 years postpartum and I'm in my 40s, feel like I'm late to the game.
Girl, not at all. You're like
Okay.
right on time. Like you are starting at a time that is so 2 years postpartum isn't that long, to be honest with you. Like our body doesn't even kind of fully recover until 1 year postpartum. I didn't even start until I was 18 months postpartum. And this is my field because I was just in the weeds for so long. And it's never too late. And so I would start now, though. Like if you were like, I'm kind of done having babies. I'm getting into perimenopause. I would proactively start working on your pelvic floor. And I have a whole chapter in the book on perimenopause and menopause because I think it's really important for us to know again, like I don't want us doing damage control 10 years later. Like we can do so much now to care for this part of our body to give us long-term health, to exercise, to have good sex, to have easy bowel movements, to have less pain. If we do that work now, we're just setting ourselves up for like more success down the road.
We did a virtual event on egg freezing, and I feel like there's a similar comp here where the expert said your eggs, somebody asked, is it too late? And the woman said, well, your eggs will never be as young as they are right now. So your moment is now. And I feel like it's kind of the same for your pelvic floor. And
Yeah.
take this opportunity as your starting base wherever you are and improve from there.
And the
Uh,
reality of it is, as our kids get older, we finally have space. Like when our kids are little, we're struggling
yeah.
and we're in survival mode. So now you're getting to a place where you can care more for yourself. And it is, like you said, like there's no better time than now.
Yeah. Someone wrote in, she said, I'm 9 months postpartum. So just to quote back what Dr. Sara said, your body is still very much recovering. A few months ago, I started to experience a higher awareness of my vagina that I never had before. It makes me pretty uncomfortable. It kind of feels like something is falling out sometimes too. Just to make sure I'm understanding, Dr. Sara, can you explain what a higher awareness of a vagina means?
Well, I'm gonna guess, Amanda, what you're saying. So jump in if I'm not right. But it's just like you feel like you're aware of it more. Like if I'm not having problems, I can kind of just go about my day and like it's not doesn't come to my mind. But sometimes you just feel like something feels a little off down there or feels a little uncomfortable. Like there's more attention and brain space that it's taking up because something's happening that doesn't feel like you're normal. What you're describing is something called pelvic organ prolapse, which don't Google it because it's very scary. But this kind of hammock of muscles that you have, it can get weaker during birth. It can get weaker with prolonged pushing. It also gets weaker, not weaker, it doesn't recover as faster if you are breastfeeding or lactating. And
Hmm.
that's not to say you shouldn't feed or lactate because I'm a long term. My kids were like driving when I finally stopped breastfeeding them. But what that does is your estrogen levels stay low, which is why you don't get your period back for a long time. So with lower estrogen, it's just more vulnerable to weakness. So what you're describing sounds like the pelvic floor is just not supporting your organs as well, and they kind of start to push down into the vagina, and that creates a feeling of heaviness, sometimes rubbing tissue, a bulge at the opening of the vagina. So I would work with a therapist, kind of start some online programs to start likely strengthening the pelvic floor muscles to kind of relift those organs and walls. But look at what you're doing because you could be straining with bowel movements, straining with picking up your kids, pushing when you pee instead of just relaxing. So some of those daily habits could also be causing some of the weakness.
You were making me so excited. I have my first pelvic floor appointment next week, and I'm just so excited because so many of the things that you're saying. And by the way, I'm almost 32 weeks pregnant, so I'm thinking the same as like Rebecca. Am I too late? But I'm glad to
No.
hear I'm not. And this is
Oh, not at
second
all.
pregnancy. I want to try a VBAC. Like, I'm just excited to learn all of these things because as you're saying, like, are you pushing during peeing? And it gets us into our next topic, which is kind of like myths and normalizing the conversation. I feel like I am peeing all of the time, more so than my first pregnancy. And I do feel like I'm pushing my pee out, but it feels like I have to pee. So
Yeah.
is it because I didn't do pelvic floor therapy the first time around?
No.
Oh,
How
girl.
old is your
Someone
first
said
no.
girls say 37.
How old is your first kiddo, Lily?
He's almost 4.
Okay. So, you know when you're pregnant with your second kid and you feel like you are 8 weeks, but like your baby already, like your belly looks like you're
I
16
mean,
weeks
I'm
pregnant or
like,
yeah.
hello. I'm like 9 months pregnant already.
Exactly. So it's like things are just a little bit more relaxed and kind of go to that like pregnancy state quicker during second pregnancies because your body's been through this before. What happens during pregnancy itself is that your the like vessels and veins and even everything in your body, like you have more fluid in your body during pregnancy.
Yeah.
And it's called urine stasis. Like things don't move as quickly. So everything's kind of like hanging out for longer. So you feel this constant urge to pee and you've just got more pressure down. I mean, you're kind of in your third trimester. Going pee during pregnancy, every 1 to 2 hours is fine. What's important is that after you have the baby, you try to not pee all the time. You get
Okay.
back to that 2 to 4 hour range. When you do pee, don't push.
Okay.
You need to sit, chill, take some deep breaths, like lean forward on your elbows and just let your urine stream flow. And then try this. Lift up your belly and lean forward again. And that can like reposition your bladder so that you feel like you empty a little bit better. And then you can even do this thing called double voiding where you like wipe, shake your hips a little bit, wipe, stand up, and then sit down again.
Yes, because that's the thing. I feel like sometimes it doesn't all come out.
Yeah. And so try those things, but don't push. Like move your hips, lift the belly, kind of go back and forth, stand up, sit down. But your bladder's never completely empty. What's normal is to have 50 milliliters of urine in your bladder, even after you pee. So you could sit there and like push pee out all day, but you don't need to because it's normal to have a little bit in there. It's just flowing quickly. You've got pressure down. So don't overthink it. Like if you have to go back in an hour or 2 hours, go back again, but don't push it out.
Got it. Okay, I'm 3 months postpartum, started pelvic floor therapy pretty quickly because my bladder never feels empty. Hasn't really improved with 8 weeks, but sounds like it may be a while. My therapist said I've kind of stumped her.
That's interesting. So, do you mind me asking, did you have a cesarean birth or a vaginal birth?
Yeah, so
Um,
Chelsea, just let us know.
yeah, so, I would say by 8 weeks, you should start seeing some improvement. So it's a little bit of making sure,
Oh,
okay, oh,
congrats, girl.
that's great. I would make sure that there's work being done on your abdominal wall and your C-section scar, even if it's from the first birth, because that can sometimes impede and impede bladder flow. I would make sure that you don't have a prolapse or anything where the bladder's kind of like sagging into the vaginal wall because sometimes it's like urine can pocket in there. And the way that I test that is I actually do that pelvic floor exam I talked about in standing because I want to see what it's like when you're against gravity. Like you can only see so much when you're lying down. So
Right.
after working with my patients, sometimes I get them into standing when I'm like, like how is this when you're upright, you know? And so I would say like look into those things, ask your therapist to work on your scar. I do something called dry needling too, which you can't do it in New York, but other states you can, where sometimes we dry needle the C-section scar, make sure all the tissues are released and relaxed, but then also that you don't have any prolapse or something like that. But some of it is just sensation. So if you're peeing and you're going back 5, 10, 20 minutes later and only a little bit's coming out, it's a false urge. It's not a true urge.
Yeah, the mind is powerful, is what
So
I'm.
powerful, but we are more powerful too. So you can override that urge.
Do you think for Chelsea in particular, like maybe seeing somebody else could be
I
helpful?
think a second opinion is always fine.
Great.
Always
Okay.
fine. And one of the things I think it's important is like, are you constipated? Because sometimes constipation puts pressure on your bladder, things like that. I am a therapist who I'm like, if you want to go see somebody else, like, go. I'm never offended. Like,
Dating.
my goal is to get you better, not for you to be like, she's the best. I'm like, no, my goal is to get you better. And if it's not me who can get you there, then let's get a second opinion. I would say 3 months is normally the time. Like by 3 months, if something's not clicking, like you either need to see a urologist or urogynecologist, or let's see if there's somebody else in my office or elsewhere I'm missing something.
Yeah. Okay. Someone said 7 months postpartum and still leaking. I still have yet to see a PT. It sounds like you need to buy a copy of Floor.
Yes.
Taking a
Um,
with a PT.
Yeah, I would definitely start working on it because the research is showing if you're leaking at 3 months postpartum, you're likely to continue to be leaking at 1 year. So now's a great time. And sometimes it's just small changes. Like I know that what I'm talking about feels like a big overhaul of your life when you're like, Sarah, I'm just brushing my teeth twice a day is like all I can manage. I'm like, well, if you're brushing your teeth, like what can you do while you're brushing your teeth that is good for your pelvic floor? Is it a stretch? Is it some contractions? Are you pooping properly? Are you, doing contractions while you're, breastfeeding or nursing or in the shower? Like, let's find a way to incorporate this so it doesn't feel so heavy and difficult, but you can still make really good progress.
Okay, so the time is now. It sounds like between if you have a therapist, if you work out and have a personal trainer, if you go to classes, if you see a chiropractor, this is just one of those things that we need to normalize. Curious for you, what are the some of the biggest myths that you hear about the pelvic floor? And I guess
We've
what
covered some of them. So one is that like C-section moms don't need it.
exactly?
Another is that only pregnant and postpartum people or aging women need it. But I've worked with young women who have pain with sex,
Yeah,
who have vulvar burning, who can't have a gynecological exam, who have endometriosis and painful periods, who have rectal prolapse from eating disorders, I mean, there's so many things. Like your pelvic floor is literally related to like peeing, pooping, sex, menstruation, core support, breathing, like
birth.
birth. Right. So it's everything. And I think the other thing is when it comes to birth and postpartum, I think a lot of people tell pregnant moms, like, oh, just wait until after the baby to deal with it. And I don't, that's gaslighting, in my opinion. Like, it takes so much courage to talk about these problems, to work up the courage and patience to wait to see your provider. And when they're just like, oh, don't worry about it, then that's why it's bothering you enough to say something, or you're curious as to like, hey, can I prevent some issues? Or I want to have a VBAC and learn to push, or like, you at least want to go into birth feeling like I did everything I could. It's like we're asking women to run a marathon, but not train. And we would never do that. And I just feel like we deserve better. We
I love
100%
that
deserve
what you
better.
just said, that we're asking women to run a marathon and not train.
Yeah. And then send them home afterwards, like, here's your baby. And by the way, try to feed it on your own and
After
recover
potentially a
physically.
major surgery.
After 30%, over 30% of moms are having C-section. So it's like after a major surgery. And it's just, people ask me like why I do what I do. And I'm like, one, I obviously like love talking about the vagina and pelvic floor. But two, you can't be in my field for 18 years and have thousands of women come in and they've suffered unnecessarily for a long time and feel like we have got to do better by them. Like we have got to. And it's the solutions are there and we just need to utilize them.
Yeah. Well, that's why people like you and the book that you wrote are so needed. So thank you so much for doing what you do. And to everyone listening, let's all do pelvic floor therapy together. I'm right there with you, starting for the first time. You will get the recording to this conversation in your Augie DMs, as well as a follow-up with key tips from Dr. Sara. And Dr. Sara, can we also link to the book? Is it available for pre-order?
Yeah, so the book comes out next Tuesday, which this is like so fun to be like right on the cusp of it because it's been such like a 2-year journey. And everyone who pre-orders can get 30 days to my pelvic floor workouts.
Great.
And I'm on Instagram as the Vagina Whisperer, which if you go to Augie's social media, you'll see me on there because we're collabing on some posts. So, but I think I want to give credit to Augie for just really helping empower and support parents. And it's one of those things that, back in my day, I mean, I was just like Googling and going, there was
Of
chat
course.
rooms back then. So just to have a space where there's so much access and support, I think is just so awesome. So I'm just really glad that y'all are doing this and that all of you took the time to attend today.
Thank you. More to come between Augie and you then. I'm so excited. And oh, do you want people to buy from Amazon or directly from the website?
Whatever is convenient for you. If you go to my website, there's a 15% off code if you order from Bookshop, which supports independent bookstores, but I
And
leave it
rate
up to you.
reviews.
And great and write reviews.
All right, Sara. Thank you so, so, so
Thanks
much.
everyone for attending. Thanks for
Great
having me,
day.
Lily.
Bye.